Hello, my name is Dr. Marc Campbell. I live in Stillwater, Oklahoma. I was in practice about 15 years and then I worked in pharma for about 10 years. You know, the cattle industry needs to come up with new and better products all the time because we push our cattle. We're expecting a one-year-old to do what a two-year-old used to. So we're always pushing these cattle and we're always pushing for more growth all the time. You know, there's no new antimicrobials on the horizon. We have the classes that we're going to have. You know, there's been some evolution of vaccines that they've made better, but we are expecting a lot out of our antimicrobials, out of our vaccines, out of pharma to do things that in a short period of time that we used to take a long period of time to do. I was introduced to Amplimune technology not very long ago, and I'm very impressed with it because the uses of it are infinite. Today we're going to talk about how you can use Amplimune in your cow-calf operation or even a stocker operation. You know, when a calf hits the ground, it's really important that they get first milk or colostrum. And if they don't get a good dose of that colostrum, they may not have an acceptable immune system to ward off any kind of threats that they may come in contact with. You know, there's lots of threats that a calf has to go through early on in life. First of all, it's dystocia, but after that, you have diarrhea or scours, and then pneumonia. Because there's lots of threats out there for a calf. There's viruses, there's bacteria, there's protozoan, and they're susceptible to all of them. And they're in close contact with them because they're close to the ground, and they have to have a strong immune system to fight those off. In my experience, this product, you can use it for all of them. It's kind of a one-size-fits-all product. What the product is a non-pathogenic mycobacteria cell fragment in an oil emulsion, which is interesting. That way you don't have to mix it up, you just have to gently shake it. It's very convenient to use. So what this does is stimulate immunity to whatever you're wanting it for, whether it's viral, whether it's bacterial. It'll work on anything. So, you know, an antimicrobial will just work on a bacteria and sometimes just work on specific bacteria. Even though it is licensed for calf scours, a product like Amplimune that will stimulate immunity to whatever I'm needing it for. The dosage, there's actually a flex dosage, is 1 milliliter up to 200 pounds, but you can use up to 5 milliliters per animal. It's labeled in the United States for IV use only, but in other countries it's been used safely as sub-Q and an IM dosage also, which is much more convenient. The unique aspect to Amplimune is it can stimulate innate immunity, that's what you're born with, and also your vaccine response. So that's kind of your memory response or your learned immunity, but it's going to enable your vaccines to work better over a reasonable amount of time. When you set up an effective immune system, it really determines the success or failure of any animal. They're going to have better feed conversion, they're going to eat better, they're just going to remain healthy. A sick animal sometimes stays sick. A healthy animal seems to stay healthy. It's not a prescription product, but it's still always a good idea to involve your veterinarian in the conversation when you're trying to make animal health decisions for your cattle. In summary, there's a lot of research involved with Amplimune, including many peer-reviewed articles. So I encourage you to do your own research, but Amplimune should be considered in your herd health program to help reduce morbidity, mortality, and scours, which ultimately will improve your bottom line.